Hi everyone, my name is Aaliyah and I worked with Lauren and Kayla to research more about childhood apraxia of speech. Childhood apraxia of speech is a motor-based speech sound disorder that can affect speech production. We will be diving deeper into the research done by Molly Bading and Edwin Massa in regards to treating childhood apraxia of speech similarly to ASD.
Today, there are treatments for childhood apraxia of speech that are proved to be effective, but there are very little treatments for individuals who have co-occurring CAS and ASD. The purpose of this study is to test a new therapy approach, autism-centered therapy for childhood apraxia of speech. Today, the researchers combined practices by having participants focus on speech sounds and followed up production trials with the participants' preferred reinforcements. They also took existing knowledge that distributed practice has been known to benefit individuals with ASD and spaced sessions out 3 times a week. They hoped that combining drill and play practice would encourage more client participation and reduce levels of communicative frustration.
The main purpose of the study was to answer the question, will children with childhood apraxia of speech and coexisting autism spectrum disorder display improvement in communicating trained targets with increased speech intelligibility after participating in autism-centered therapy for childhood apraxia of speech? As we all know with every study, there should be an educated guess on what the outcome might be. The researchers provided a hypothesis in favor of the treatment, improving short and long-term speech production for children with autism and apraxia of speech when producing previously trained targets. Participants in the study matched the following criteria. Each child was between the ages of 4 to 7 years old. All 3 children were male. Each child had normal hearing based on screenings or a parent report. All were from English-speaking households. Each had coexisting diagnoses of autism or childhood apraxia of speech. Each child had a lexicon of less than 30 spoken words, so there was minimal verbal ability for each child. Treatment targets were tailored to each child based on observation and discussion with parents. And it was top priority that treatment was provided in a quiet room for each session. Drill-based portions of treatment were provided by the SLP, while play-based portions incorporated the caregivers.
Real-world implications. After the study was completed, the goal was to improve speech intelligibility and help maintain social interactions. Reduced speech intelligibility can affect social interactions negatively by leading to misunderstanding and frustration. It can also lead to loss of interest in communicating with others. Real-world implications. Now we are going to discuss attention, social praise, reinforcers, and other differences. Children with autism may have difficulty with maintaining attention, so incorporating things such as play-based practice may be beneficial. Social praise after each attempt and remaining on task can also lead to a positive outcome and can be very motivating. In order to encourage participation, using reinforcers with autism-centered therapy for childhood apraxia can be beneficial when practicing speech production and can help with any challenging behaviors. It was found that generalization and maintenance of certain skills can be challenging for participants with autism spectrum disorder and childhood apraxia of speech, but taking all of this into consideration does greatly improve short and long-term speech. The studies led to the conclusion that more studies need to be completed with larger groups to specify which children are most likely to benefit from this approach and can maintain the intensity and the regimen. Clinicians do have to be cautious about using the traditional childhood apraxia of speech approach with this population due to the amount of drill-based practice, imitation, and verbal comprehension. Treatment and session frequency also play a big role, and some clients may need more or less treatment time during the week. Now we are going to